All right, welcome back in. Traditionally, infertility has focused on the female partner and her eggs, but more and more research is showing in the field that has indicated that the male partner and sperm matters as well. Fertility specialist Dr. Beth Malizia joining us virtually from Alabama Fertility. Thanks for joining us today.
Thank you for having me.
All right, Doc, so tell us exactly why this is a topic that we should be interested in talking about.
Well, infertility affects 10 to 15% of the population, which accounts for about 73 million couples worldwide. So many of your population out there watching right now could be affected by infertility. And most couples are surprised to learn that 40 to 50% of fertility factors are on the husband's side or partner side. So it's not all about the eggs. It can be sperm related as well. So
how do you evaluate sperm?
Most evaluation for sperm is done through a standard semen analysis. This can be performed in a fertility center such as Alabama Fertility. It's usually either a covered expense by insurance or is an inexpensive out-of-pocket expense. We analyze that specimen for volume, count, movement, and other parameters. For women, we're born with all the eggs that we are ever going to have. Men are constantly making sperm, so we expect those sperm counts to have some natural variation to them. If we get a count back that's a little bit low in terms of the count or the movement, we simply have the male come back in for a recheck. Sometimes we'll do some laboratory evaluation with them as well.
Yeah, so what kind of lifestyle factors or things that men do in everyday life that could help them in trying to have a baby?
We used to concentrate very much on the female partner for their chances of pregnancy, since she's the one carrying the pregnancy. And there's more and more data that the male health is important as well. The most common thing we discuss is healthy diet, regular exercise, being at a healthy weight, both for the male and female partners. If men are smoking or using any tobacco, we will encourage them to stop that. Most men know that smoking affects their lungs. When we start talking about that affecting their sperm, they might get a little bit more interested in stopping. So we encourage that as well.
Yeah. So when couples are trying to have a baby, and that's not happening, when should couples seek out the help of a fertility clinic?
I'm glad you asked. In general, we are happy to see couples anytime. Fertility is defined by a year of trying without success. If a woman is over 35, we recommend about 6 months of trying before they seek care. However, many couples come to see us either preconception or want an evaluation prior to even trying. And for women who have abnormal menstrual cycles, or for men or women who have any health conditions or other concerns, we encourage them to seek out the care of a fertility expert. It's generally covered by insurance. That visit, we're not going to put somebody into a super expensive cycle tomorrow. We get a full evaluation and can go from there.
All right, Dr. Beth Malizia with the Alabama Fertility. Thanks for joining us today, and I know that couples will definitely be using that information to heart very soon. Thank you so much, okay? All right, coming up,